Gentlemen, if you are over the age of 50 and you've recently noticed something unsettling during intimacy, I want you to pause and listen carefully. You may still feel the familiar surge of pleasure, the unmistakable sensation of climax, yet afterward you notice little or no seminal fluid. If this has happened even once, it can spark immediate worry. If it's happening repeatedly, it can quietly eat away at your confidence. And if you've kept this to yourself out of embarrassment or fear, this message is especially for you. My name is Dr. Lena. I am a urologist with more than a decade of experience working with men across every stage of adult life, from early adulthood through advanced age. Today, I want to have a calm, respectful, and supportive conversation about a topic many men struggle with in silence. What you are experiencing does not mean your masculinity is gone. It does not mean your intimate life is over. And it certainly does not mean you have failed in any way. Instead, it is a signal from your body, and signals are meant to be understood, not feared. I want you to stay with me because in the next few minutes, we're going to unpack what this change really means. We'll talk about why it happens, when it matters, what warning signs you should never ignore, and most importantly, what modern medicine can do to help you restore peace of mind, confidence, and well-being. Knowledge in this situation is power, and understanding replaces fear with clarity. Before we discuss what happens when fluid is absent, it helps to briefly understand how this process normally works. Think of the male reproductive system as a precisely timed system. The testicles produce sperm. The seminal vesicles create most of the nourishing fluid that carries those sperm. The prostate contributes additional fluid that protects and supports them. All of these components are collected in the urethra, the same channel used for urination, and prepared for release. At the moment of climax, a specific sequence of muscle contractions occurs. These contractions are coordinated by nerves and guided by signals from the brain. When everything works together, the fluid is propelled forward and outward. This process happens quickly and automatically, and for most of your life, it likely occurred without a second thought. It is a remarkable example of coordination between muscles, nerves, glands, and hormones. Here is a distinction that many men have never been told, even by doctors. Climax and ejaculation are not the same thing. Climax is a neurological experience. It occurs in the brain and nervous system and produces the sensation of pleasure. Ejaculation is a mechanical process. It is the physical movement of fluid through the reproductive tract. Most of the time, these two events happen together so seamlessly that we assume they are inseparable, but they are driven by different systems, and one can change while the other remains intact. Our focus today is what doctors call dry ejaculation. This is the term used when a man reaches climax, experiences pleasure, but notices little or no fluid afterward. Many men describe it as an empty orgasm. The sensation is there, but the expected physical result is missing. That gap between expectation and reality is what triggers anxiety. But it is essential to understand that your ability to feel pleasure may remain completely intact. The issue lies in the delivery system, not your desire, identity, or worth as a man. Before we break down the main causes, let me pause for just a moment. If you value clear, medically grounded conversations about men's health that are free of shame and fear, consider liking this video and subscribing to the channel. This helps more men find reliable information and reminds the algorithm that this content matters. Now, let's talk about the most common reasons dry ejaculation occurs, starting with the leading cause. The first and most frequent cause is called retrograde ejaculation. To understand this, imagine a small muscular valve at the opening of the bladder. During climax, this valve is supposed to close tightly, acting like a gatekeeper. Its job is to prevent seminal fluid from flowing backward into the bladder, ensuring it only travels forward and out of the body. If this happens when this valve does not close properly, the fluid takes the path of least resistance and flows backward instead. When this happens, you still feel climax. The nerves and brain are doing their job, but because the fluid is diverted into the bladder, very little or none exits the body. A practical clue many men notice is that their urine appears cloudier after intimacy because the fluid later mixes with urine. This condition is often seen after surgeries involving the prostate or bladder. These procedures may be life-saving or essential, but they can affect the nerves controlling that valve. Certain medications, especially used for high blood pressure or an enlarged prostate, can also relax this muscle. I once treated a patient who was deeply distressed after prostate surgery. He believed something fundamental about his identity had been lost. When he understood that this was a mechanical change, similar to a traffic signal stuck open, and his desire and pleasure were untouched, the relief on his face was unmistakable.
The second major cause is obstruction. In this case, the glands are producing fluid normally, but the ducts that carry it are narrowed or blocked. Think of these ducts as delivery pipes. If a pipe is partially blocked, flow is reduced. If it's fully blocked, flow may stop entirely. Obstructions can result from scarring after infections, particularly severe or untreated prostatitis. In rare cases, small calcifications can form and block the passage. Symptoms may be subtle. Some men notice gradual changes in volume over time. Others report mild discomfort in the pelvis during climax. The encouraging news is that many obstructions are treatable. Inflammation can often be reduced with medication, and minimally invasive procedures can restore normal flow when necessary. The third major area to investigate is hormonal, particularly low testosterone. Testosterone is the primary fuel for the male reproductive system. It influences desire, sperm production, and the function of the prostate and seminal vesicles. When testosterone levels drop significantly, fluid production declines. Initially, this may show up as reduced volume. Over time, men may notice decreased libido, less firm erections, and less intense climax. Beyond intimacy, low testosterone often brings fatigue, mood changes, and loss of muscle mass. This condition, known as hypogonadism, is not something to dismiss as normal aging. It is diagnosable with a simple blood test and often treatable. Carefully managed hormone therapy can improve energy, desire, and overall quality of life when appropriate. While most cases of dry ejaculation are manageable, there are important exceptions. If this change appears suddenly without explanation, or if it is accompanied by pain, blood in the urine or fluid, fever, or loss of sensation, seek medical attention promptly. Conditions such as neurological disorders, long-standing uncontrolled diabetes, or rare urological cancers can interfere with nerves or pathways and must be evaluated. Beyond the physical causes, we must acknowledge the emotional toll. Many men equate ejaculation with performance and virility. When it changes, feelings of inadequacy and anxiety can surface. Some men begin avoiding intimacy altogether, not because desire is gone, but because fear has taken its place. This silence can strain relationships and deepen distress. The most powerful antidote to this cycle is understanding. This is a physiological change, not a personal failure. Pleasure, connection, and intimacy are not defined by fluid volume alone. With information and open communication, confidence can return. Here is a simple action plan. First, do not ignore the change. Whether sudden or gradual, it deserves evaluation. Second, manage underlying conditions like diabetes, high blood pressure, and cholesterol as they directly affect nerve and vascular health. Third, break the silence. Talk with your partner and your doctor. Conversation opens the door to solutions. In summary, gentlemen, the absence of ejaculation is not the end of your intimate life or your masculinity. It is a message from your body that deserves attention, not shame. Understanding whether the cause is mechanical, obstructive, or hormonal is the first step toward peace of mind. I have seen many men regain confidence, vitality, and joy once they received clarity and support. If this message helped you, consider sharing it with someone who might need it. Like the video to help it reach more men, and subscribe to the channel for honest, medically grounded guidance on men's health. Your best years can still be ahead of you. Be proactive, stay informed, and take good care of yourself.